You wake up one morning and feel even more exhausted than when you went to sleep. You feel pressure on your chest. The pressure turns into pain. You're getting scared now, really scared. If you can just hold out, you can drive to the hospital. It's just around the corner. Somehow you make it to the emergency room. The pain is now spread from your chest to your left arm. It hurts so much you want to pull your arm off.
There's something wrong with me. I'm in serious pain.
Well, yes, ma'am. If you could fill out the insurance form, I have a seat right over there.
Each year, hundreds of thousands of American women are struck down by a deadly and silent threat.
Oh no, you don't understand. I'm in serious pain.
What'd you have to eat last night, ma'am?
I didn't eat anything.
How old are you?
The warning signs are often ignored by patients and the health professionals they rely on.
Well, I hope you can appreciate that we have a room full of people with serious emergencies. Please have a seat. We'll get to you as soon as possible.
In the time it takes to watch this program, hundreds of women will lose their lives to a killer few of us seem to recognize.
The disease that kills women most is probably breast cancer.
I think it is smoking right now.
Cancer, I would say cancer would be the #1 killer.
Heart disease.
It is heart disease?
I didn't know that, really.
I'm amazed, yeah.
Mention heart disease, and most of us think of middle-aged men as the victims. But heart or cardiovascular disease is an equal opportunity killer. Each year, cardiovascular disease claims the lives of over 500,000 American females, roughly 10 times more women than die of breast cancer. Sadly, incredibly, thousands of women's lives could be saved each year by their own physicians. Julia Robinson is in her late 60s, but she was well on the way to a heart attack as a young woman. Over the years, the warning signs were there, but none of her doctors took her symptoms seriously. Recent studies indicate that many physicians are much more likely to diagnose heart conditions in their male patients. Whether you're a 67-year-old gardener or a 29-year-old graduate student, you stand a good chance of being ignored to death if you're a woman.
Several months ago, I was addressing an audience, and a doctor's wife walked up to the microphone to tell her story. She said she complained to her husband for at least a month of substernal pressing chest pain. And he, concerned, made an appointment for her with his male colleague who was also a cardiologist. The cardiologist worked her up, sat her down in his consulting room, and said, "You have no heart disease. I'm going to take your husband aside and tell him to take you away for the weekend and give you what you need." 1 month later, that woman had her first coronary. And I can tell you, she was furious when she told the story, and I presume she's still angry about the treatment she received.
In New York City, Marianne Legato teaches future doctors to give women patients the same respect as men. Not long ago, she too was unaware of widespread gender discrimination.
Women are not offered the same high-tech interventions as men. The American Medical Association has made that statement quite formally in 1990. It's not a secret. There is gender prejudice in health care.
Legato's private practice is devoted primarily to women. Many have suffered from the symptoms of heart disease and the deaf ear of their doctors.
Prejudice can be lethal for women. A refusal to believe that a woman can have a heart attack because she's still menstruating. A patronizing attitude to a woman that makes her embarrassed to tell you the extent of her symptoms can lead to missing a diagnosis altogether and result, as I have heard several times, of women going on to have major heart attacks.
Even the most ambitious study of heart disease fell short in assessing the risks to women.
I have a female doctor now, which was very concerned with my cholesterol, as she put me on a strict diet. And even though the cholesterol came down, it wasn't down enough. So now I'm on medication for it. And I think she's trying very hard to keep me alive.
The longest-running study of cardiovascular disease took place in Framingham, Massachusetts, just outside of Boston. Back in 1949, an epidemic of heart attacks had swept the nation, and scientists were desperate for answers. Since the population here had a tendency to stay put, they were perfect subjects for a long-range investigation.
We went along with it. We thought it was a good thing.
Yeah, I thought it was great. The greatest thing that came down.
Roseanne Thomas is a second-generation volunteer as the study begins its 44th year.
This is my mother, Giuseppina Bertolino, my father, Vincenzo Bertolino. They were immigrants from Italy. They came at 21, and they joined this business. And in the 50s, they were asked to participate in the Framingham Heart Study. They were really very happy about it. They wanted to help as much as they could.
Some 5,000 volunteers, 3 generations, have allowed researchers to pry into their lives and bodies for clues to heart disease. Their contributions to medical knowledge have saved millions of lives around the world.
Again?
Oh, yeah. All right, whenever you're ready. Tube in right away. Blast it out! Good, good, good. Keep going.
When it began, Framingham was the only study of heart disease to include both males and females in equal numbers.
Keep pushing and stop.
Housewives, postmen, and bank clerks helped scientists nail down the risk factors that provoke heart attacks. Among them were age, diet, smoking, and a family history of cardiovascular disease. Ironically, the initial study failed to discover that women were in grave danger. According to Dr. Peter Wilson, the reason why had to do with timing.
We started out with age 30 to 60, but there really wasn't much heart disease in our younger women. We had to wait until our 30 and 40 and 50-year-old women had aged several years, 10 to 15 years into our study. So now you're taking a study into the mid-60s. Took us 15 years before we started to get enough heart disease in women to be able to talk about it at our scientific meetings.
And no heart medicines, no blood pressure medicines.
Researchers concluded that females were low risks for heart disease. Later, new diagnostic devices proved the women of Framingham were indeed at risk. By that time, a generation of physicians had graduated medical school misinformed. One of them was Dr. Ted Diethrich, now a cardiovascular surgeon in Phoenix.
Hi, Sally, how you feeling? One day I was walking out of the operating room and I went in intensive care to make rounds with the nurse, and bed after bed after bed I was seeing a female patient. And as I was walking out, I said, well, obviously we've got to reorient our thinking about this, because we're seeing now almost as many females that need open heart surgery as males. You look real good.
Thank you.
I think those bypasses must be working, huh?
Finally, one woman's extraordinary case inspired Diethrich to create a treatment program especially for females.
It was a fear, I guess, in the back of my mind that I always had, because my mother had passed away at such a very young age. And then when I did find out that I had it, was fighting the doctors who really didn't want to listen, or didn't really want to care for me the way I felt I should be cared for.
In 1977, Pat Taylor, her husband Richie, and 2 sons lived in suburban Long Island. The Taylors worked hard for their piece of the American dream. But Pat's side of the family had a history of heart disease, a past that finally caught up with her.
In 1978, when I got the first attack and I went to the hospital, the very, very first reaction was that no way is this your heart, lady. They just couldn't comprehend in 1978 that a 36-year-old woman could have heart disease. But I did.
In spite of 2 operations, Pat's condition worsened. A clogging of the arteries known as atherosclerosis had done so much damage, her doctor literally told her to go home and die.
I think that Pat was an inspiration for us to begin looking at heart disease in women a different way and to really understand and focus that it is an equal opportunity disease for male and female. And so we developed a program that was focusing and directed toward Pat and women like her, and not only to detect heart disease at the early stages, but also once a patient has heart disease like Pat, to teach them how we can prevent this, of course, from going on later on in life.
Diethrich designed a series of customized workouts and backed them up with a nutritional guidance program. After 8 months, Pat began to put some distance on the killer.
I was physically fit. I was running 3.5 miles every day, 7 days a week, and I had a new lease on life.
But Pat also knew that once cardiovascular disease strikes, it can strike again. After 10 years of stability, Pat suffered a mini stroke, a blockage of blood to the brain. To find its exact location, her doctor, Sam Kynard, performed an angiogram. Pat let us film this procedure to encourage women not to be afraid of the technique. Under local anesthesia, a thin tube called a catheter is inserted into an artery in Pat's leg. The catheter is eased through the circulatory system into the left artery of the neck. A dye is injected to reveal the precise position of the clot.
Felt that one.
The dye is sensitive to X-rays, allowing a picture to be taken of the blockage.
Feel hot and more pain in my head.
Patients feel a momentary discomfort when the liquid is pumped from the catheter.
I can feel sparkles in my eye, and it's pain in my head. That's it.
The most difficult test for heart disease is over in about 40 minutes. The angiogram pinpoints a blockage in Pat's left neck artery. Surgery is necessary to remove the threat.
This is your left carotid. The narrowing is there, and the narrowing is significant. And you've had 2 of these episodes where it stopped up little vessels, so I think the treatment's going to be surgery.
Within 24 hours, Pat returns to her home just outside of Phoenix.
Dr. Kiner just told me that he'd scheduled it for Friday, and that the risk factors would be that I could have a stroke on the table, or my heart could give out. For the surgery, I would assume.
Pat's husband passed away a year ago.
For the cholesterol or anything.
Her son Alex must now accept the chance that she too may leave him. But Pat is a fighter. A week later, she's more than ready for the operation.